Until diverticular formation is completed, the pouching process is advanced by intraluminal ongoing force of pressure. This has already been described 50 years ago by the radiologists, where the pre-diverticular state has been described. And demonstrated by the Roman school, this is the colon of the same patients in a dynamic enema, where diverticular appears belonging to the state of contraction of the colon. So we still it's still stated that diverticulosis primarily appears to be associated to segmental motility disturbances in the colon that result in localized area of intraluminal pressure within the bowel. Besides the intraluminal pressure, by sure there are some other factors as low wall compliance, an altered wall tension, and a weakened structural integrity. Since we are speaking about motor disorders, we have to consider the neuromuscular apparatus in its entirety, where we have mesenteric plexus, both longitudinal and circular muscular, and interstitial cells of Cajal. And several alterations have been seen in the three components in diverticular disease. Alterations have been reported in the enteric nervous system. Alterations have been reported in ICC, and alterations have been reported in smooth muscle layer. The studies on muscles are kind of old, but still there are evidence of alteration of the three components. When we speak instead of diverticular disease, apart the neuromuscular abnormalities, there are some other factors which are involved in pathogenesis, such visceral hypersensitivity, low-grade mucosal inflammation, and pro-inflammatory dysbiosis. There is a recent paper from Professor Barber which described the loss of anti-inflammatory species in the mucosa of the diverticular disease patients. So it is probable that in symptomatic diverticular disease, microscopic inflammation occurs. It has to be kept in mind that in inflammatory situation, smooth muscle cells present a phenotypic switch, which is induced by the inflammatory condition that drive a switch from the contractile to the synthetic phenotype. And we already described a contribution of intestinal smooth muscle in Crohn's disease fibrogenesis. For the reason, this muscular phenotype is regulated through two pathways. The contractile phenotype is mainly driven by the TGF pathway, and which is blocked in the phenotypic switch in a tissue-dependent manner. In the vascular, the contractile phenotype is blocked by an increase of PDGF-beta, which increases microRNA-24, which inhibits TRBT, which is a molecule fundamental in the TGF-beta signaling. In renal, instead, there is a reduction of SMAD2, which abolished the activation of SMAD4. So the signaling of the phenotypic switch is tissue dependent. The aim of the study was then to evaluate the myogenic contribution in motor alteration in terms of contractile activity, inflammation, and phenotypic switch, both in asymptomatic diverticulosis and complicated diverticular disease. For the reason, human colonic specimens were taken from diverticulosis, both from the area with diverticulosis and the area without diverticular, and from complicated diverticular disease. We use as control a colon of patients which underwent hemicolectomy for colonic cancer. Strips and smooth muscle cells were then obtained separately from the circular and longitudinal muscle, and the following studies were done: morphological studies with contractile effects, gene expressions for fibrotic markers and inflammatory markers, the study of the secretion of IL-1 beta. Functional study has shown that in circular muscle there is a progressive decrease in response to acetylcholine, which is already apparent in the colon without diverticular, and progressively decrease from when in the presence of diverticular and in the stenotic segment. These alterations seen in strips were not present in cells, indicating that probably this modification is due to a myoteric involvement. Instead, in longitudinal muscles, the alteration in contractions was not different between the different segments, and the alteration was seen at the levels of the cells, suggesting a myogenic impairment. In parallel, we observed that inflammatory molecules were expressed both in circular and longitudinal muscle. In circular muscle, the expression of the inflammasome molecule was higher than in longitudinal, and there was also a component of TNF-alpha, and the activation of the overexpression of the inflammasome molecules was accompanied of an overexpression of IL-1 beta. It has to be noted that this pattern of inflammatory response decreased in the stenotic segments. To better understand the expression of inflammasome molecule, we studied the co-molecules of the complex, and we found again that both molecules needed to activate the complex were more activated in circular and longitudinal, and progressively decreased in stenotic segments. This was accompanied to a secretion of IL-1 beta. In parallel to the decrease in inflammatory markers, there was an increase in collagen in circular, with a decrease of the contractile smooth muscle active, and these phenotypic markers increase in the stenotic segment in circular, but were already present in longitudinal muscle, independent of the stage of the diverticular disease. Finally, we studied the pathway of the phenotypic switch, and we observed that in longitudinal, the phenotypic switch was driven by the PDGF beta, which was increasing the stenotic segment with a decrease in TRB3, while in circular muscle, the pathway driving the phenotypic switch was different. It was Maduro-mediated. In conclusion, intrinsic myogenic alterations are present in colonic diverticulosis and complicated diverticular disease, both in circular and longitudinal layer. Smooth muscle cells of both layers, independently for the presence of the diverticular, are associated with an inflammatory state and an impaired contractile activity. And in complicated diverticular disease, the myogenic inflammatory state progressively decreases, and phenotypic myogenic alterations appear in both layers, ending in a muscular synthetic profibrotic switch. Intrinsic smooth muscle alteration contribute then to motor disorders in diverticular disease, opening the area for future research and possible new therapeutic strategies. Thanks.